Hi everyone, my name is Silva, and today I'll be doing my case presentation on Charlie Kelmeckis from the film The Perks of Being a Wallflower. I'll be going over his background, his mental health symptoms, the diagnosis that fit him best, and what treatment could possibly help him. For this slide, I'm going to be talking about character description and setting. For the character background, just to read off of the slide. Charlie is a 15-year-old starting his freshman year. He's quiet, shy, and has trouble making friends at first. He recently came home from a short stay in a psychiatric hospital. He's still dealing with grief after his best friend Michael's suicide, and he carries a lot of guilt and confusion about things that happened in his early childhood. So yeah. Um, the story takes place in the 1990s American high school where mental health wasn't really openly talked about. Boys especially were expected to stay tough. So Charlie doesn't really have a great space to express what he's going through. Even his family avoids talking about heavy emotions, or they just keep their conversations very superficial and uplifting, if you want to put it that way. Um yeah, and this school environment just was really clicky and focused on finding your group and fitting in and not standing out and all these different things, which was just a lot of added pressure for Charlie on top of all the things that he's already dealing with. Okay. For my diagnosis, I decided to go with PTSD and depression for Charlie. Yeah, my main diagnosis were post-traumatic stress disorder, which is for short PTSD. Charlie shows trauma symptoms connected to his aunt and other past events, and yeah, the two these were the two diagnoses that I thought best fit Charlie. He shows symptoms for PTSD. He shows symptoms like trauma flashbacks, guilt, sadness, and withdrawing from people. Um, but yeah, in the DSM-5, PTSD includes things like intrusive memories, avoidance, and mood changes, depression. Oh, sorry. And my second diagnosis, which was major depressive disorder, for short MDD, he struggles with sadness, guilt, low energy, and overall just withdrawing from people. Depression includes persistent sadness, guilt, sleep issues, and isolation, all things Charlie heavily deals with throughout the whole entire film. And because this is set in the 90s in the US, a therapist would very likely diagnose him with these two disorders. Yeah, so the DSM-5 connection, like I earlier stated, it's the PTSD involves things like flashbacks, avoidance, and changes in mood. Depression includes the low mood, guilt, sleep changes, and trouble functioning. And Charlie shows multiple of these symptoms from both category, which I cited where I got my information. And I read a little bit more about it from the American Psychiatric Association 2013. And yeah, how culture plays a role. It is a 1990s US setting. Like I previously stated as well, a therapist would likely diagnose the PTSD and depression diagnosis that I also agree with. In some cultures, trauma gets described as stress, nerves, or even physical issues, and the mental stigma could make someone like Charlie avoid getting help, overall. Okay, now for this slide, I'm going to focus talking about culture, diagnosis, and the stigma around it. Um, yeah, so in the culture of the film, 1990s America, people didn't really talk about trauma or mental health, especially teenagers, because they were most of the time the ones that were dealing with all of these heavy emotions that they couldn't really pinpoint or seek out help for without feeling embarrassed or shamed for it. So Charlie's symptoms could easily be missed or minimized, honestly. In other cultures, trauma might be described differently, maybe as stress, nerves, physical pain, or even spiritual imbalance in some cases. So the way his symptoms are labeled depends on the culture, I would say, and there's just a lot of stigma around it. People with depression or PTSD are often seen as weak, and teens don't want to seem quote unquote crazy, which makes someone like Charlie stay quiet instead of getting help that he desperately needed. And boys especially were expected to just shake off these emotions, um, and just overall just hide them until it just got really bad for them. Um, but yeah, and because of the cultural view and all of these different factors that teenagers had to deal with in this time, Charlie was labeled differently, and he was just seen as an outcast in a way. And yeah, and a research example that I came up with was this study showed that culture shapes how PTSD symptoms are understood and diagnosed. I did cite the Hinton and Lewis Fernandez 2011 uh, study, and yeah. Okay, for this slide, it's gonna be my evidence for my first diagnosis, for diagnosis symptom number one, which was the PTSD, post-traumatic stress disorder. One of the strongest symptoms I would say Charlie shows is intrusive memories of flashbacks, which is a core PTSD symptom. A clear scene is a cafeteria fight where Charlie completely freezes and dissociates. He hears his aunt's voice and mentally relives the traumatic moment that he tried so long to suppress from his childhood. He can't tell what's real in that moment, which is exactly how a flashback works. He can clearly hear his aunt's voice and mentally goes back to that like awful traumatic moment, and he can't, like I said, he can't really tell the difference between past and present during his episode. And then yeah, this is why I would say if it's PTSD, because for PTSD a lot of the time flashbacks are a main symptom, if you want to put it that way. And Charlie's overall reaction just shows intrusive trauma memories taking over his body completely. And a research report that I came up with was the flashbacks strongly predict impairment in PTSD and are a key symptom. And I also cited the Brewin 2010 for that one. Okay, now for symptom number two, which I decided was depression. Um, he also shows a lot of like depression symptoms. The biggest one is excessive guilt. I would say Charlie constantly, blames himself for his aunt's death, even though it wasn't his fault in the slightest. He breaks down crying throughout the movie, isolates himself, and pulls away from friends when he feels overwhelmed. Those are all classic signs of major depression. Um, yeah, and why I think if it's depression is guilt, low mood, withdrawing from people are classic like depression signs. And Charlie's sadness comes up repeatedly throughout the movie, and it is one of the main, if not the main, focus of the film, I would say. And a research report that I included was studies show that guilt and negative self-blame are common in depressed teens, according to Shahar and Prill 2003. Sorry for the mispronunciation of the names. Okay. For this slide, I'm gonna be talking about symptom that is not clearly shown. I would say is persistent hyper hyper arousal. Sorry, PTSD. An example would be being jumpy, really irritable, trouble calming down. Um, yeah, Charlie definitely has anxiety, but we don't see the typical PTSD hyper arousal behavior. This is important to mention because it shows we're not forcing the diagnosis and then we understand the full DSM-5 criteria in order for this to like fit completely. Um, Charlie has anxiety, but we don't see it like I stated. He constant constant startle reactions, ongoing irritability, always being on edge, quote unquote. These behaviors are part of a hyperarousal category in PTSD, and they're not 110% clear in the movie. And I would say this matters because it shows you're not forcing the diagnosis, like I previously said. And yeah, it proves like I understand, or the audience understands the full set of DSM-5 PTSD symptoms, and it helps explain why flashbacks and depressive symptoms are the strongest evidence, I would say. Now for the next slide, proposed treatment plan. Okay, my recommended treatment plan would be trauma for CBT, TFCBT. helps teens work through trauma, guilt, and negative thoughts, or EMDR therapy used to reduce flashbacks and emotional intensity around traumatic memories. Um, yeah, I would say these would be the best recommended treatment for Charlie. The TFCBT helps the teens, like I said, work through trauma, guilt, and negative thoughts. Um, EMDR is great for flashbacks and dissociation, which he experiences a lot of. These treatments are commonly used for teens with PTSD, so I think this would be a great fit for Charlie. These are also there are also ethical concerns around it, like making sure therapy doesn't re-traumatize him, keeping things private and monitoring um any sign of potential self-harm. And we just overall want to make sure he feels safe and supported in all of these sessions. And barriers he might face is once again the stigma around therapy, especially for boys, teen boys. If that in high school, we all know how all of this could be interpreted by other males around his age group. Family avoiding emotional conversations, fear of being judged at school, and limited access to mental health care depending on Charlie's location. Now for this slide, I want to talk a little bit about ethical concerns and barriers. There are a few ethical issues to think about, making sure he feels safe, not pushing him too fast, and protecting his overall privacy. Charlie would also face barriers like stigma around therapy, especially for boys, like I previously stated. His family avoids emotional conversations like a majority of the time, and he's overall just really scared for being judged at school. He wants to fit in so badly, and I think those things make it harder for him to open up to his full potential and actually um, start working on a lot of these issues that he has and he's trying to work through. Not to sound repetitive, but yeah. Um, yeah. And then broader perspectives. Overall, the movie actually does a really realistic job of showing PTSD and depression in a teenager. The flashbacks, guilt, sadness, isolation, they match real symptoms that people of his age group might actually have that are dealing with these diagnoses. Movies like this can help reduce the stigma and help people understand how trauma affects teens. It also shows how important support and friendships are. I honestly think that the friendships that Charlie formed um saved him from a lot worse a lot sooner, and I think that is so important to like check on your loved ones and to make sure that everyone feels supported in every aspect of their life, especially when they are struggling, because we all have our moments of weakness, especially at such a young age, and high school can be really difficult for a lot of people. And yeah, I overall think that this film like encouraged people to take symptoms seriously and seek help if you need help. Yeah. And I feel like movies like this can make mental health struggles feel more human and relatable rather than it just being like something that you should be ashamed of or hide because you feel like you're gonna be judged to it, because we never know what is going on behind closed doors. And if you need help, you should 110% always seek that help out. And these are just my references. I have them all right here. Yeah. Thank you so much.